Today we are going to be demonstrating the wound care competency for you. First, you're going to gather your supplies. What you'll need is sterile applicators, your ABD cover pad, your packing gauze, and a pair of sterile gloves. When you come to your station, you'll have your saline, your hand sanitizer, your tape, and your non-sterile gloves at the station. First, I'm going to perform hand hygiene. I'm going to provide privacy for my patient. I'm going to introduce myself. I'm going to identify my patient with two patient identifiers, and I'm going to explain the procedure to the patient. I'm also going to offer my patient pain medication 30 to 60 minutes prior to doing the procedure. I'll position my patient appropriately, and then I'm going to wash my hands. I'm going to apply clean gloves. I'm going to remove the dressing. I'm going to remove the dressing gently, being careful not to tear the skin with the tape. I'll hold the dressing in my non-dominant hand. I have a dry ABD, and I have gauze saturated with serosanguinous drainage. I will wrap the old dressing inside my glove. I'm going to contain the contents within the glove, take my other glove off over it, and then I will dispose of this in the garbage. Next, I'm going to describe my wound. I have a stage 4 sacral pressure ulcer. There's 50% granulation tissue, 50% slough. Bone is exposed. There's no odor. There's 100% undermining and tunneling at 9 and 1. Next, I would state that I would don clean gloves. I would irrigate my wound with sterile saline. I would pat the wound dry with gauze, remove my gloves, dispose of them, and wash my hands. Now I'm ready to set up the sterile field. I'm going to set my sterile field up in the order in which I'm going to use my supplies. First, I need to tear my tape for my dressing. So I need 2 longer pieces, 2 shorter pieces for the ends of my dressing. I need a piece of tape about medium length to put my applicators on the table, and then just a short one for my date, time, and initials. Next, I'm going to open up my sterile applicators, being careful not to touch the inside, and then I'm going to tape those to the end of my table. At this point, I cannot reach over my sterile applicator tips. Next, I'm going to open up my packing gauze, and the only thing I can touch is the edge here. I cannot touch inside the package, and I have to open it away from my body, and then I'm going to just move it up into the corner. Next, I'm going to use sterile saline. I'm going to keep the lid in my hand so I don't contaminate it, and I'm just going to pour from the corner so that I don't go over my sterile gauze with this bottle, because the outside of the bottle is not sterile. Next, I'm going to open up my ABD pad, and just the edges are where I can touch. Everything else is sterile. Again, we're going to open this away from the body, and if that should happen, you just have to work with it. And I'm going to move this up out of the way. So I have my sterile field set up closest to my wound, and my garbage is here. By setting it up this way, I will not turn my back on the sterile field, and I won't turn my back on the patient. Next, I'm going to open up my gloves, and these are sterile gloves. And by setting up the sterile field this way, you have a large area over here that you can work with. So I'm going to open my gloves being careful not to cross over any of my sterile supplies. And I can only touch the perimeter edge of my gloves. The first glove, we're going to reach in and grab it by the cuff, get it up out of the way, and pull it on. The second glove, we go under the cuff, get it right up off the table, and then go ahead and put that on. Now once I have my gloves on, I must keep my hands above my waist. First I'm going to go in with one hand and grab my packing gauze, wring it out, and then I need to fluff it because I need to loosely pack the wound. So I'll be opening up the packing gauze. And I open it up to this state. It's about half open. Now I'm going to fold it in half again, and I'm going to lightly or loosely twist it. Put this up into my hands, tuck any frayed edges underneath, and I'm going to grab one of my sterile applicator tips. Now at this point, I'm going to start packing my wound, and I'm going to pack closest to me so that I know that I have all of that undermining tissue packed. And so using my sterile applicator tip, I'm going to pack this wound, being careful not to touch any of the gauze on the outside of the wound or the tip of my applicator. It all has to remain inside the wound. Once I get all the way around, before I lay my gauze down, I'm going to go back and just pack in to make sure that I've got it all packed in that undermining area. Once I have that done, then I can fluff this and go ahead and put it right down into the center of the wound. Keeping my hands above my waist, I'm going to dispose of my applicator tip, and I'm ready to use my dressing to cover it. Now with the dressing, I can only touch the outer part of the dressing. There's a blue stripe that's on the outer side of the dressing, and so we can grab that only by the blue stripe. And when we go to put the dressing on, we need to put it right where we want it. Once it's on, we cannot move it or we would be dragging bacteria into the wound. So my dressing is on. Technically at this part, the sterile part is completed. So now I can tape it down. So my hands will go below my waist at this point to grab my tape. And we tape the side towards the buttocks first so that we can get a nice seal. So we don't want stool getting up inside our dressing, contaminating our wound. So continue to tape the wound in a window frame fashion. And the last piece of tape, I will put my date, time, and initials, and I will adhere that right to the dressing itself. At this point, I'm going to clean up my supplies. I'm going to reposition my patient for comfort, and I will remove my sterile gloves. I'm going to wash my hands, and I'm going to describe what I would chart. I performed a dressing change on a stage 4 sacral ulcer. There was 50% slough, 50% granulation tissue. The bone was exposed. There was no odor. There was 100% undermining, tunneling at 9 and 1, and my patient tolerated the procedure well.